Hi, I'm Dr. Sandeep Kadam, consultant interventional cardiologist and founder and director of Dr. Kadam Heart Clinic and Diagnostic Center, Baner, Pune. I'm working as an interventional cardiologist for more than 10 years. So today we'll discuss about the diet for hypertension patient. So what should be the ideal diet for the hypertension patient? So in short, it is called as a DASH diet. What is DASH? DASH is a dietary approaches to stop hypertension. So in that, what includes? So what you should have and what you should avoid in your food. The most important is the potassium is important to control the blood pressures, and other ingredients like magnesium and calciums are important. So these ingredients are helps in controlling the blood pressures. And what should be avoided is the saturated fatty acids. Second is the sodium intake and other food substances like sugars, added sugars. So what amount of salt is allowed for hypertension patients? Maximum per day intake of salt or sodium. So according to the DASH diet, the limit of sodium intake is 2,300 milligram per day. That means near about 2 gram per day, which comes to a small teaspoon of salt. And in a patients who are having other disorders like hypertension associated with kidney disease or with heart failure, in that scenario, we need to cut down the salt by sodium by 1,500 milligram per day. That is 1.5 gram per day. It's less than a small tablespoon salt per day. So this is the most important, as sodium is important to control the sodium intake is important to control the hypertension. So basic principle here is with increased sodium intake, there is a water retention in the body. So sodium takes water with itself, and that leads to increased volume of the blood, and that lead to hypertension. So this is the basic principle. So that's why we need to control the intake of sodium. And with DASH diet, there are some important factors like you should have a green leafy vegetables daily. Daily a fruit and green leafy vegetable is important. Whole grains are important. You can have dairy products, low fat dairy products, low saturated fats, fish, poultry, beans, nuts, and other food substances. So the most important crux for the DASH diet is low sodium, that is maximum of 2,300 milligram per day. That is a small tablespoon salt. And in a scenario where hypertension is associated with the heart failure and kidney disorder, the salt intake or sodium intake should be 1.5 gram. Thank you.